Hi, this is Ringo Majingos. You are listening to Rumbi Venge on radio. Don't change the dial.
I'm Rosella Miller. You're listening to Rumbi Venge on Capitalk 100.4 FM, Harare's heartbeat.
My guests are in the studio for our Capital Forum discussion. I'm joined this evening by Tafadzo Ameki, a licensed counseling psychologist and national coordinator at SALT Africa, as well as Thelma Chidamajaya. She is a neuropsychology graduate, as well as programs coordinator for SALT Africa. Ladies, it is a good evening and welcome. Tafadzo, how are you doing?
I'm good, thank you, Rumbi. Good evening, listeners.
Wonderful. And how are you doing, Thelma? Good evening.
Good evening, Rumbi. And how are you, Zimbabwe? I'm doing very well.
Wonderful, wonderful. I love it, ladies. Welcome, welcome. So we want to talk about postpartum depression. A lot of people seem to think that it's all about just having, once you've gotten through the 9 months, once you've gotten through labor, everyone has an exciting, sometimes a harrowing story to tell about, how they gave birth, their labor story, that it ends there. You then walk away with your child and life is just rosy. There are, however, some of these unexpected challenges. Talk to us about that before we even get into the signs and symptoms and breaking it down. Bring us into that view, this is supposition that Jajongo Pera and what is going on through a new mother's mind after birth.
I love how you've sort of brought it down and brought it home. I don't like speaking academically when we're having conversations. And then I also love the term new mom. A new mom doesn't mean she's a first-time mom. A new mom is a new mom every time she falls pregnant and there is an outcome, whether positive or negative. And I think that needs to stick because every single pregnancy carries differently and has a different outcome. And this is whether or not the outcome is positive. We can say, Makorokoto Rumbi, you've given birth, but you've probably given birth at 25 before, and now you've given birth at 36. It's a different experience. You've probably given birth to a girl, now you've given birth to a boy. You've probably given birth by cesarean section, now you've gone normal, as people call it. Yeah. The other word I cannot say on air.
NVD is cool.
Yes, NVD. So we need, I think the starting point is every single birthing experience, pregnancy experience carries differently, comes with its different experiences. And when the baby comes out, it's a whole new level of psychological and emotional complications. The hormones are on a different level. There's breastfeeding, there's production of progesterone levels are high. We're looking at emotions, even there's a crying baby. For a woman who has stitches through NVD, it's a whole different physical pain, emotional pain, fatigue from lack of rest because and we want to see the baby and we want to keep the mother chatting, and then she can't sleep. We say it's very difficult for the adult clock to just go back to sleeping during the day, and she's not sleeping at night. And let's not assume that everyone has a partner. Every woman who's given birth has a partner, or every woman who has given birth has a supportive partner or a present partner. And some partners, for the partners before they slay me, they may be present but may not be able to understand the depth of what this woman is going through psychologically, especially I'm on a veteran, and you have to veteran on, but you're burning inside.
Wow. Yeah. You got me when you said, and it's not everyone who's got a partner. And we'll touch on that as we progress in the conversation. But, let's get into the science of it, into the psychology of it. So maybe, Thelma, you can break it down for us. Postpartum depression, postpartum anxiety, what are we talking about and how do they present?
Okay, thank you, Rumbi. So postpartum depression, we are talking about persistent sadness, hopelessness, and guilt that occurs when a mother gives birth. So this can be attributed to a whole lot of different factors. And as a result of this, you see a new mother, disconnecting from a baby, and even sometimes, they are overwhelmed, they're having difficulties to sleep. And in most cases, if you have postpartum depression, it means it's going to affect milk production. So you have low milk production, and you have all these other problems that are accompanying the whole process that you're having. When you're talking about postpartum anxiety, there is excessive worry. Probably you had a miscarriage before, or you're a first-time mom. You really don't know how to take care of your baby, and there's pressure from the society, the community, or even your family, and you have a baby that you need to take care of. So as a result of this, the main problem that comes with it is challenges with breastfeeding. And there are certain conditions that comes up with not properly breastfeeding your child, like there's jaundice, and you have to go back again to the hospital to nurse for that baby and all that pressure. So postpartum depression and anxiety, it really takes a toll on a woman, especially a new mom, or even a mom who has had other previous children. Every pregnancy have its own story, and it's really different.
Yeah, it is indeed. And you know what I mean? I don't want this to be about me, but I understand. And when I saw the title, I said, well, this is a program for us, so I've got, I'm how many days counting? 198 days postpartum and counting. Yes, thank you.
And you're in studio.
And I'm in the studio.
Yay.
We say that, but so let's talk about some of the risk factors then. Would you say that someone like me is at risk of developing postpartum depression, postpartum anxiety, just because I'm here and functional seemingly? Am I at risk, and what are some of the risk factors?
Okay. Yes, Rumbi. I think let's put this into perspective. I love that you've allowed us to, and you've used yourself as an example.
Yes, I am.
The more we make this real, the more people actually realize that, look, it's not just a subject. It's every single woman you meet every single day is going through something. You said you're 198 days.
Yes.
Counting.
Yes.
Statistics show that women only start, and keyword is start, becoming themselves after 2 years post-delivery. After 2 years.
I wish there was a camera in here to follow. So it's going to take me 2 years to find myself again.
Yes. So
600.
risk factors. We're talking age.
Okay.
I like age because we get a lot of people at the hospital who walk up to us and say, "Thank you very much." Because of my age. So your age, and then the community you live with, or your social system, so to speak, can be your risk factor, unfortunately. People with history of depression, diagnosed depression, and also people who are constantly living in a high-charged life, constantly on the go for whatever reason. And back to Rumbi as the example. Yes, you have so many risk factors. You're a celebrity. You have to look a certain way, but you didn't sleep last night. And then you look at your photo where all of your other co-presenters, co-hosts are like, yay, and they're slaying, and you're there with puffy eyes. And to be honest, during that time, mafuta batire kumeso. Like, no matter how hard you try, you have to get like a professional to do your makeover.
Oh my
That
goodness.
dab makeup that we put in the morning will not work. By the time you get to work, you're tired. It's gone.
Because you had a
And
long night. Huh?
You're constantly getting, hey, and it's a constant reminder of, oh, so I don't look the way I normally look. Again, Rumbi, as an example, you're a celebrity, so you should swing back on, hey? And you told us you're pregnant online, so we are pregnant together. We want to see the journey. Let's be pregnant. Let's give birth. Let's postpartum together. But we forget that behind the Rumbi Venge Capitalk, there is the Rumbi Venge. And that is who she actually really is. This all is a facade because it pays the bills and she loves it. It's what she loves to do. But there is a person behind that celebrity. So this is a high risk factor for popular people, so to speak. And then we've also got risk of support or the absence of social. What is your social net worth? Do you have a support structure? Are you going to work? Because with some women, you'll find, we talked about being single, having a partner, present absent partner, and then also being the sole provider in that relationship, or if you are single. So say for instance, you are, what do they call them? You are an entrepreneur. I need to be correct. I was looking for the right term. You're an entrepreneur.
If
You're
you're
self-employed. That's the term.
Uh-huh.
You're self-employed. And you have a preterm birth. That's give or take a month or so in hospital. Who's making the money? And you have another child that you've left at home. Who's paying the bills for that child? Bills don't stop coming. Responsibilities don't change because you have given birth. The world is not going to say, oh, okay, pindai mu supermarket, amai nemakorokoto, take a shopping bag and just pick what you want because you're self-employed. So you see, those are things that we take for granted, but those are the real things. Those are the real issues that you will not find in books, especially bringing things back home here in Zimbabwe, where we are saying we have a lot of self-employed women. We have a lot of women who are bringing the money home. Well done to you. But unfortunately, when this happens, responsibilities don't change. Expectations don't change. You have your medical bills. Who's going to do that when you're not working? But when we come, we say, Rumbi makorokoto. What do you say? You're not going to sit us down and start saying, oh, I'm sad because I'm back on my rent. I'm behind by 2 months and landlord. Let's not talk about diapers and probably formula and that you're not sleeping. And probably looking at the dynamics, sadly, of some of the relationships in this country. And I speak about this country because Ndwe and Dinosira. There's a lot going on. And not just women, I know even men, but today we are talking about women. You have given birth, Rumbi. Auna kumba, you don't have a place where you call home. Because the dad, the owner of the pregnancy, then decided, no, I can't, we can't have this anymore. I'm not doing it. I'll support. Support doesn't come instantly. It comes as and when the person feels like it. But where are you going? What are you going to be
this
eating?
Is the reality.
It's the reality. So forgive me for those that are listening and are expecting me to go bookish. No, I'm not going to go bookish because these are things that I encounter, well, Thelma and I encounter on a daily basis. And these are the real issues. and they make me sad. So I think I'm going to stop talking before I cry on here.
Yeah, no, but I mean, sometimes we need to get to the heart of the situation, and as Taff says, so we've talked about what it is, we've talked about the symptoms. You also talked about a connection between postpartum depression and bonding. Tell us exactly how this happens. Maybe caregivers and so forth, for them to start to notice no, this sadness hopelessness kave kutoda some clinical and professional help.
Okay, thank you, Rumbi. So normally mothers who have postpartum depression, they have a challenge or a problem, or they don't have the ability to connect and engage with their babies. So you find a mother she cannot even respond to your baby's cues. Manaka chema, she acts like she's not there. But chema. And then sometimes you see with bonding she cannot even breastfeed your child. I think kuchema kwakanyanyisa it's because it's been long asina kunwa mkaka. So in the hospital unotona kuti munhu anogona kutobuda ototendera, in other words, kuti avoid mwana wake, because the moment the baby is going to cry, it means kuti atova affected. So you see kuti zvino affecta mwana kunyanya. And also remember, there's malnutrition. They need the mother's milk, but mother cannot even provide for the baby, or even okay, I need to change my baby a diaper. They cannot even do that. Bonding is really restricted, and it's difficult because the baby and sometimes the mother cannot even notice what she's doing is not befitting at the moment. So it needs very close to that person. Let's suppose they are discharged, to take a closer look at your relatives, to closely monitor them, because normally they avoid a lot of things and they want to be socially withdrawn, to be on their own. Kuchema kwe mwana kwe kunwapa irritability yakanyanyisa, and sometimes antuta enga yokuti they neglect or even abuse their children. Kutakangochema karikadi kuna kakutoronzi unochema sterekiwe unonetsa. And it's not good they want to do that, but it's because of this postpartum depression that we're talking about. And kashinji I'll always refer kuchipatara, because you would see kuti munatozvara mwana yake achimuda, but zvazotongochinja mukaka uri kutobuda and akatozvimba hembe yakatotota kutaura that she needs to breastfeed, but haasitombozvifunga kuti I have to give my baby mukaka. So there is neglect yakanyanya between the mother and the child, and bonding only comes back with you are breastfeeding your baby, and then you're telling your baby positive stuff. You know how you're looking at your child and the child is looking at you. You're connecting through that way. But then if you're not doing that, how best are you going to connect with your baby? Yes, indeed.
Okay, we're going to talk about the solutions, Aripo, but I think there's an important message here for family members. Vanobatsira vacho, vanadzimbuya, madzipanga mazano, vanasekuru, the uncles, the sisters. Let's talk about the type of support that a loved one with the PPD or PPA should be getting tafadzwa. Toita say sevavakidzani sevagere imomo kana tazvipika zvataurwa izvi kuti every time the baby cries she's looking irritable, haasi kunyasa kuwa net care and attention yatinotarisira kubva kuna mai vabva kusununguka.
I think zvakakosha kuti, I think chataura mamwe ma statements are very common so that tifambirane. Amai mwana ndozvinoita kuita mai, handi ndimaidzi here nhumbu idzi, depending kuti urikuzvitaura uri because you're a young mom here or just also vasikana mukabva mateta kudai saka muchatoguma naiye one. We need to understand that there are 3 women in the studio. Well, Thelma is excluded in this conversation, but Rumbi and I, we've both carried, but your story is different from my story.
I hear you. Yeah.
Whether you've carried once or twice, and I've carried 10 times or 5 or 6, Your story can never be my story. Chero tese tanga tiri mu private hospital. Chero tese tanga tiri pa clinic. Chero tese tinozosvika kuchipatara tikabatsirwa mungoro or whatever. Your story is never my story. Let's stop imposing my experiences edu on vana amai vachangobva kubatsirwa. You can clap.
I was snapping, yes, snapping.
And let's stop assuming kuti tine masolutions. Ngatisataurai patinenge tisina kukumbirwa kunzi titaure. Sometimes when you don't know what to say nothing at all. It's very important for us to be cognizant of the fact that I'm not just dealing with giving birth. I'm dealing with a host of things. My life has not changed. Because no. So let's keep that in mind. And I think it's also very important. I should have mentioned this by my risk factors, but I'm mentioning it now because Pinda. For those women that come home with a live baby, vakamboshaikirwa noumwe mwana ndapota ngatisiyanei neunhu hwekuti anti unoona mwari vatokutsiva mwari vareplacer. How do you expect me to feel? Ndatova conflicted. Oh, zviya ndakarasikirwa nemwana, or maybe I'm still so anxious about it kuti saka ndichakwanisa here. Pamwe ndozvinotokonzeresa anxiety and depression because I'm not sure if I'm able to carry this one ari mupenyu because I lost the other one. Let's not say ende mwari vagona makabata musataura nyaya dzenyu pamwana muchinyepera kunge muri kutaura nemwana imuchitoudza muchindiudza kuti ende mwari maita henyu matipawo chipo chedu makambotitorera. It's very sad.
It's toxic.
It's toxic. I know a lot of people mean well, and pane vanotaura vachiti vasingazivi ngavadzidziswe. Ngatibvumei kudzidza. Even as I am talking to you right now, I learn every single day. I think Thelma can. She's actually laughing right now. We've had to change settings, manuals, tools, intake forms, and because we are learning every single day. And trukudzidza kubva kumadzimai acho ane pamwiri arasikirwa nevana vane vana vabatsirwa asi vari preterm. Ngatizivei pekugumira, ngatisataurai zvatisina kukumbira o zvatisina kubvunzwa. Ask, nai Rumbi, ndingakubatsira sei? And patinonoona vana mwana auya naamai kubva kuchipatara, when we ask, arisei mwana makorokoto, let's remember to ask the mother how she is doing. And antinenge taenda chiti tukuenda unoona mwana, ask how can I help? Pamwe ari kungoda kuti chingondibatira mwana, all those symptoms ataurwa naThelma. You could ask if she would like you to just hold your baby, her baby, or if she would just want a hug. Sometimes approach mubate pabendeketa her shoulder.
And Hans asking in a low voice and say,
Thank you.
Just, can you allow me to do this?
Yes.
Can I hug you? Or can you allow me to do the chirungu chayend? Can you allow me to do this? And then advance and hug, because sometimes vamwana vatombozive hug yacho vakapedzera kuiwana kudhara musi wavatobata pamuviri saka pamwe haasi kutoinzwisisa, and they need that.
Absolutely.
So let's be considerate. Please, Zimbabwe, ndakumbirawo madzimai ane pamuviri ndo vari kutivakira nyika. The generation of a Zimbabwe to come, we need to be more considerate.
Absolutely could. You know, you hit the nail on the head with that one, Taff. Thank you so much. Hanzi kune vanhu vanofanirwa kuzvinzwa izvozvo. There's a few messages coming in. This one's from Patrick saying, I didn't know that women go through so many difficult experiences after giving birth. Daima authorities agadzirawo supporting structures to help women ease the pressure. For example, paingoitawo mari inopiwa these women for a certain period after giving birth. So like a postpartum allowance, I think this is what he's talking about.
I'm going to give birth again.
Yes, I think if you do that, you're not going to go with it.
Depending on my postpartum allowance.
But I can see Thelma, celebrating, as I'm reading that message. What is required in terms of support? As this listener is saying, kuti postpartum depression, postpartum anxiety, inge ichibatwa, inge ichitariswa, inge ichiitwa pamusoro muno muZimbabwe. Toziva kuti pane mamwe matambudziko ariko zvawo, asi ichi chinhu chakakosha.
Thank you, Rumbi, and thank you, said Patrick.
Yeah, Patrick.
Yes, thank you, Patrick. I will clap hands for you. Thank you so much. So, Rumbi, first and foremost, I'd like to thank Parenya to a group of hospitals for allowing us to do our pilot project at Mbuyane Maternity Hospital. It's not an easy journey as people think it is, because umwe nomwe mafungira ake ni matauro ake kuti how kaita numbu zvatoita chasara kuti tozokuti makorokoto. People don't really know kuti there's positive and negative birth outcome. It's not every mother who goes to the hospital pregnant anodzoka katakura mwana wake. So in terms of support, trukutaura kuti yes, you are your mom, right? I'll give an example of you. There are simple things that the family can do over vanogara navo to help you. Kubatirwa mwana cheko, child care. Kungoti chimbozorora iwo. Vokubatira mwana iwo uchimborarawo. Kubatirwa ni mabasa. And remember, there are some people who they don't even have the family that we think could inengeri kukunzego, and they solely depend on themselves. So vanenge that support, be a listening ear. Apana chinorwadza pakuteerera mumwe munhu kuti ari kuti chii, but pa listening ear pacho Rumbi, people please Zimbabwe ngative nechipfuva kana tichinge taudzwa nyaya dzevanhu, because zvinozowedzera postpartum depression is I tell tough my story ozoenda nayo kuchibhorani, then you know how it is. It comes back to me again. I'm still anxious about the baby. Probably I had a miscarriage before, and this is my first time baby. Saka, and let's try to create safe spaces where we talk to people. We're not judgmental. We're not judging them, and we're just offering a listening ear to them. And you know, what you're doing, we're doing maternal mental health education talks. Every morning, we are telling mothers of the changes that comes with hormones, and we are telling them that we are there for them to know support throughout the pregnancy journey, whether it's a positive or negative birth outcome. We are there with them, because sometimes it's just a simple listening ear. I'm there to support you. I'm there to listen to you. So I'm saying to Zimbabwe, let's try by all means to be very non-judgmental and create safe spaces for our mothers.
Hey, sure, that's fantastic. Some feedback. We've got Gogo Varipanapa, Gogo Madison, Gogo Varopa, Varkutanz, and Takatotora 2 months leave Kubasa, Kutindimbo Batsira Mwana Wangu Panga Batsirwa. And then this one from Mary says that this is a powerful topic. Thank you, ladies, because she actually asked if she can get the clip because her daughter lost her firstborn giving birth, and she says thank you in advance. This has been so powerful. Now, as we come to the end of this discussion, there's a suggestion here from Ernest saying male involvement from the time during labor until manasi amkaka. I definitely agree with you. In closing, Taf, your message kune the first time mothers, the new mothers, the fathers, the partners, absent, present, absent, all of them.
Thank you, Rumbi. And for Ernest, yes, this is why Thelma is really but I think we just need to acknowledge, because for what Ernest is asking for, Bianehanda has availed that, and we have seen male involvement, Varume Vakuyoku antenatal classes, and that is just beautiful to watch, and they love it. But Kumure Zimbabwe, we are all born of a woman. kwatakabva pane shona inoti, I know my shona is kind of deep, gavi rakabva kumashuriro. Mashuriro edu ndivana amai vedu. The women we encounter, I'm talking to the men, the women we encounter vanozobata pamuviri. Ngatifunge vana amai vedu kwatakabva isusu makavi acho. And remember, kana pazobata pamuviri, whether pava success waita a positive or a negative outcome, tinogara tichitaura kuti it takes a village to raise a child. Let's take a moment and pause and think kuti iyi village iyi inozoreza sei a child tichitadza kusapota amai vari kutiunzira mwana uyu.
Iyi topic inobata moyo zveshuwa, asi ndoda kutenda kune vedare vedu this evening, Tafadzwa Meki na Thelma Chidamajaya. Ladies, it's a very sensitive one, this one, but thank you both for coming in ndinokutendai, and we want to have more conversations of this nature, so thank you so much, ladies. Tafadzwa and Thelma, good night.
Thank you.
Fantastic.
Hi, this is Ringo Madlingozi. You are listening to Rumbi Venge on radio. Don't change the dial.
I'm Rosella Miller. You're listening to Rumbi Venge on Capitalk 100.4 FM, Harare's heartbeat.